So my name is Pasco Hearn. I'm a consultant in infectious diseases and microbiology. I'm currently working at NHS Blood and Transplant and also at the Royal Free Hospital. So before I started infection training, I worked for a year in southwest Uganda in a place called Mbarara. I did general medicine there and teaching in the medical school. And then towards the end of my infection training, I went to Siem Reap in Cambodia for a couple of years and worked in Angkor Hospital for Children there. Yeah, so in the NHS there's a lot of resources and people put into trying to reduce the amount of hospital-acquired infections that we have. That's not the case in resource-poor settings. In Cambodia, in many of the government hospitals, that hospital-acquired infection is not the priority. They have other priorities. And so things like having gloves on the ward, having hand-washing targets, that falls by the wayside. Actually, the place I worked at in AHC was getting better. They had an infection control nurse. And they recognised that when you don't give any attention to infection control, you do get issues with hospital-acquired infections, with resistant bacteria causing problems in the hospital, and within and outside of hospital. Antibiotic stewardship, when that falls apart, then that leads into the same problem. So as an infection reg, I was working at UCH and Royal Free, and both of those hospitals have their own guidance on microguides. So as a microbiology reg, you're often being phoned for advice, and this allowed people to kind of look in their pocket and find that advice. So you got fewer phone calls, and also you could just refer to that whenever. It was in your pocket the whole time. Yeah, so Microguide is an app for a smartphone, and it gives people a platform on which to populate their own guidelines, antibiotic stewardship guidelines or antibiotic use guidelines for their own hospital. So you can get that template and fill it with your own locally relevant data that can then guide the doctors on the ward, who can just bring up this app and look at the guidance for this UTI, what you should treat for how long, and it can really tighten up the use of guidelines locally. Yep, so I ended up going to Cambodia towards the end of my training. I think I still wanted to go and work abroad before I became a consultant, and a post came up at Angkor Hospital for Children, funded by Public Health England. And when I arrived, I was working in the microbiology lab, but also on the wards. And it was clear that we were having a lot of resistant organisms come through. It was a major problem, and we wanted to address that and see how we could best go about that. Part of that was about making it very clear to doctors on the wards that there were antibiotic guidelines, and some of it was about kind of repopulating that and making it up to date and in line with locally relevant international guidance that might be different to the guidance you'd read in books from the UK or America. And then take that to the ward in a way that doctors on the ward could use that to kind of affect their daily routine and what they were prescribing on the ward. Yeah, so when I got to the hospital, there was we realised we were going to have a more of a clinical presence on the ward, and you could see that there were, the doctors there were good and they were motivated and they were knowledgeable, and they're treating a broad range of conditions, not just infection. And part of trying to reduce the number of hospital-acquired infections and the resistance pattern in the organisms was tightening up on infection control standards, but also educating about infection and bringing in these guidelines. And part of the app is also an educational tool as well, because you can put information there about the infections, the diagnostic criteria for them, and then also how to treat them. So we would kind of have regular ward rounds, and then we implemented the microguide and told everyone how to access it, to download it on their phones. We then had access to data to show that the doctors were downloading it and how much they were opening it to guide their kind of their practice. And then we realised that, as we were going around the wards, people were referring to these guidance, and people were tightening up the antibiotic choices that they made, the duration of the antibiotic course that they were giving, and how appropriate the antibiotic choices were in each situation. We were monitoring those, and in the end we realised that there was a significant change in the amount of hospital-acquired infection there was, and that was one of a few factors, but it contributed to huge cost savings in a resource-poor setting. That's a really important factor. It became clear that even in resource-poor settings, often doctors have smartphones in their pockets, and if they had these guidelines available, then they're going to use them. So we were able to populate that microguide specifically for Ankle Hospital for children, and then they were using it. They were also telling their friends about it, and we were able to really kind of update their guidance and change their practice on the ward. I would say that it's a really useful tool to have in your pocket. I think that it allows you to populate it with your own specific information which is relevant to your area of work. It allows you to change as patterns of resistance change in the organisms that you find locally. You can update the app and it updates everyone's when next time they open it. So you keep your guidance relevant, updated automatically. You're able to work with not just the kind of local microbiology labs, but also more regional, international guidance, as opposed to the guidance that might be out of date and might be from the UK or America, something that's more kind of bespoke. Once you start using that, the antibiotic stewardship effects will be great. You'll start kind of treating people more appropriately for a more appropriate amount of time, and hopefully you'll see less of the kind of the resistance patterns and the infection problems. So I think it can really tighten up our use of antibiotics, which is going to be a key thing moving forwards.